Because of her disability and certain health problems, they referred me to 3 facilities in Southern California who could help me. UCLA picked up the phone and scheduled an appointment for me a year from the day I called.
The wait list just to get into our clinic can range anywhere between 6 to 12 months before they're actually able to be seen. A lot of it has to do with just access to care. There aren't a lot of dental clinics or facilities or practices that may be comfortable treating patients with special needs.
Having the capabilities versus the desire, I think, is 2 separate things. You know, working with this population requires much more time, much more expertise, yet the reimbursement is extremely low. And given such, I think the drive to treat this population then becomes more of a compassion, desire to help out. A life worth living. You know, I think part of it is very simple. Be happy with what you have, you know, how lucky everyone really is. And go out and help people, help those who are less fortunate. And when you have a whole group of people who are here for that reason, I think we then become collectively much larger as a whole than a collection of the individuals.
You know, when you're given an opportunity to help somebody and you've been given so much in your own life that you, at least for me, I feel like I want to give it back, you know, just try to make somebody's life just a little bit easier or a little bit better, you know, take them out of pain or give them a better smile. None of us could do it alone. I think all of us need each other to make it work, you know, because for many of these patients, they need a lot of help in many different ways. And so it's great to be a part of that team.
So in the hospital dentistry clinic or special patient care clinic, we provide comprehensive dental care on a wide variety of patients. The patients that we see are typically very medically complex, have intellectual disabilities or physical disabilities. Unfortunately, many of these disabilities may coalesce into their overall condition. Hi. I know you can't touch anymore. It's the new treatment, huh? Okay. Yeah. So go ahead and take your mask off and just show me. But I just want to look. Is that okay?
Yeah.
All right. Okay. I'm gonna take a look. Oh wow, you got some silver teeth in there, huh? So. All right. Thank you very much. And of course, you're worried about this guy right here, right? That's completely broken down. We'll see if we can save that guy. Okay. All right, thank you. That was very helpful. Okay.
You're welcome. I did a good job.
You did a great job, actually.
Thank you.
Thank you. Okay, so I'm assuming your mom's a legal conservator then, right?
Yeah.
Hi, how
It
you
feels
doing?
amazing because I know my mom's struggle. She's been looking for dentists outside of like our local area, and you know, finally like getting here to the appointment, like it just feels great, you know, to actually like come in here, sit down, and like talk with the doctor, you know, and discuss like the whole process about it. Like it was very relieving to I know my mom and to myself, especially because you know, we're always trying to take care of my brother as much as we can, you know.
How far did you guys drive today?
We came from Paris, so Riverside County, so
Okay.
like an hour and 40 minutes. Yeah.
We're trying to see if someone's available and just get started on the process so you don't have to come back. Is that okay? Saves you one trip.
Dice que van a ver si pueden trabajar en el para que no van a to sedate him today?
No. We can't do that. We have to do a more thorough workup, blood pressure and all that.
Okay.
So with that paperwork, we send to Medi-Cal for pre-authorization. That takes 2 months to go through. But it saves you one trip because today I just did the screening, which is accepted. You get to come here if you want, you know. Okay. Then the third appointment is where we put him to sleep. Okay? So here you go. He's a pleasant 26-year-old kid. He's actually fairly high functioning. He's wheelchair bound because of the hip fracture. No meds, no allergies. And mom and sister, she's a younger sister, actually brushes his teeth twice a day.
It's a pretty complex machine, the way we all work together to provide care for patients. We have 6 full-time dental residents. These are dentists that have already graduated from dental school and have chosen to do an extra year of training in general practice as well as in the management and treatment of special needs patients and medically compromised patients. Dr. Sung and I and Dr. Mincer are the full-time faculty members, but we have a really great team of part-time faculty members as well, both general dentists as well as specialists in different areas of dentistry to help us. You know, it's really about teamwork, and some of the most essential parts of the team are the staff. We couldn't do what we do as dentists if we didn't have the assistants. You know, we couldn't see the patients in the operating room if we didn't have our front office staff to get the insurance authorizations and the scheduling done and, you know, call the patients. You know, they go the extra mile. Oftentimes they're calling doctors, they're calling, you know, the insurance agents and telling them, you know, how important it is and how vital it is to get these authorizations so that patients can be seen.
I'm very, very anxious, very, very nervous. Because I don't know what they're going to tell me, honestly. Because she hadn't seen a dentist since 2014 due to her health condition and her special needs. And plus me, I was working full-time away from the home. So when I became a stay-at-home parent and was tending more to her personal needs, and that's when I did try to get dental services. It's been, you know, me having to brush her teeth, her, you know, having to hold it, because she can't do it. It's a sensory issue. It's a lot of pain, a lot of discomfort when she with the brush and her gums because of her autism. So as the course of the years went by, she's got a lot of buildup, a lot of dental work needs to be done. This journey began in May of 2019. That's when I first tried to schedule an appointment. Because of her disability and certain health problems, they referred me to three facilities in Southern California who could help me. The first facility, they weren't able to help. They said because she is an adult, they only do pediatric. So next on the list was UCLA. UCLA picked up the phone and scheduled an appointment for me a year from the day I called. Yeah, so I made this phone call September of 2019. So 1-year wait list.
The wait list just to get into our clinic can range anywhere between 6 to 12 months before they're actually able to be seen. A lot of it has to do with just access to care. There aren't a lot of dental clinics or facilities or practices that may be comfortable treating patients with special needs, or they may not be equipped to treat patients with unique needs.
Actually, because I think it's bizarre that these are the only options in Southern California. These are like real slim pickings for this region. There should be more facilities, you know. There should be more options.
Oh, stay down.
No, stay down. No, Mom. Stay. Thank you, everyone.
Did she get the prescription?
Geez. The thing about it is, had they not been able to take her today, we would have had to wait another 18 months. So we're kind of fortunate to get in today. Yeah.
Imagine this special needs nonverbal child, you know, having a toothache, and the parent trying to figure out what's wrong with them. They've probably taken them to their primary care physician, you know, to see, oh, maybe they have like an earache, or maybe they have this, maybe they have that, and they can't figure it out. Then they finally, oh, it's a dental issue. Then they come in to the dentist and they're told, oh, by the way, we can't see you right now because we have a long list of patients already waiting to be seen. So you're going to have to get on this wait list. And then once we see you, we have to send a special authorization request to your insurance company that could take a couple weeks to get back. And then you have to come back to get your child sedated so we can evaluate what's going on in their mouth. It's just crazy. It shouldn't be this way. Sometimes it's depressing. It's depressing. And we try and we strive so hard to do the best that we can for the special needs population, but it's never enough. A lot of times patients, when they talk to me, and then I'm like, I get it. When your kid is sick, you're trying to think of what's wrong with them. What can I do to make it better? And these kids or even adults, because I've seen 60-year-old ladies come in with their special needs 40-year-old son. It never ends. So I think for me, that's also changed my perspective as a parent, because I would be neurotic thinking what's going to happen, as they get older, as I get older. Being a mom never stops, and their illness doesn't go away either.
It's helpful to repeat to yourself that you're helping, just because sometimes it doesn't feel like you are, but it's just something that you need to constantly remind yourself that you are providing a service. So we see a lot of patients who are going through pre-radiation, and they've already had so much taken from them, and you end up needing to extract 5 teeth. And in the moment, it doesn't feel great because you're it almost feels like you're kicking them while they're down, but just constantly reminding yourself that you're there to help. It gets you through it.
When I see these patients, oftentimes, instead of feeling oh yes, I'm actually doing something great for them, I just feel this horrible sense of shame almost, why, it's too late for me to do anything at this point. And sometimes we see patients who haven't been able to see a dentist for years and years and years, and you're oh my gosh, if only we had caught this years earlier, it wouldn't be such a problem. And we're faced with extracting teeth, and it's just, yeah, to be honest, I wish it were more fulfilling, but instead it's just made me really angry sometimes. I haven't burnt out yet or anything, and I think it's definitely incredibly, important to do this sort of work, but I think it just speaks to the character of, our attendings who have been doing this year after year, that, something keeps them going day after day. And because I personally find it incredibly frustrating that, yeah, great, it's great that they're here, but what about all the care that they didn't receive?
Having the capabilities versus the desire, I think, is two separate things. Very few people will be willing to do something that's this challenging. Many of these patients may not understand why they're here. And if they don't understand why, much less allowing us to get in their mouth and say, open your mouth, that's a very invasive location, and they may be combative, they may be vocal, they may scream. That is extremely disruptive to any dental clinic. So for that dentist to try to be willing to do that, instead of seeing a different patient where perhaps you could complete multiple procedure, it could be challenging. The average dental student graduate with $300,000-$400,000 in debt nowadays, and if you're treating this patient population, it is not financially rewarding, or is very difficult to make it financially rewarding. And given such, I think the drive to treat this population then becomes more of a compassion, desire to help out.
Listen to your heart. Thank you. Very strong heart.
So I was born with cleft lip and palate, And that's a condition where you need a lot of medical treatment, a lot of surgeries, as well as a lot of dental work. What's really crazy is I was treated here at UCLA when I was a baby. And when they helped build my smile and I grew confident, I really fell in love with the field and I wanted to be just like them. So being a dentist now here, I've treated patients with cleft lip too. And it just feels like a big full circle. And I feel really honored to have this privilege. And I hope that one day the doctors that treated me would know how much they have given me and be proud that I'm also returning the gift back to another patient, another family, another population.
No, far. We traveled. On the second visit, we actually stayed out there to avoid, the traffic, because Alex, he works. So, it was a work conflict too, so we wound up spending the night out there instead of coming back home. I'm trying to wrap my head around that. In all of Southern California, UCLA is the only facility able to provide services. I'm glad they were able to help. So I guess it goes deeper than the dental. She does have issues with her liver, and she was pre-diabetic, She can't communicate that to me. How's she gonna say, hey, this feels unusual. Hey, Mom, I think I need to see a doctor. This doesn't feel right. There's no way she could communicate that to me, even with the device. So that's one of the things that I worry about constantly underneath, all the things that I wish she could tell me, as far as how she's feeling, what she wants to do with her life, what she wants out of life. There was a time when she could speak. She stopped speaking between 18 and 24 months. Just stopped. There was no isolated incident, that there was nothing traumatic. She just started to regress vocally, so she stopped talking. And she used to mimic, she used to sing. Then one of her last words was amen. And all of a sudden, she just, no more words. Honestly, we thought she was going deaf. We thought she was losing her hearing. We had no idea. No clue that it was autism. She was 4 years old when I got the diagnosis that she was autistic. To understand what it really was and how it's a neurological condition that's lifelong, I was blown away. When I first got the diagnosis, I broke down on the ground and just cried because I didn't know, what do I do now? What's gonna happen to us? I didn't know where to. I felt like I was drowning. I just lost control of everything. Didn't know what to do. It just took a toll on me mentally. I had to leave my marriage. I had to go to my parents. I had to start over. Finding work, going back to school. It took me 10 years just to get to where I'm at now since the diagnosis. I worked 40 hours a week in an office while trying to take care of her. I was trying to dig myself out of that hole. So it is a lot of hard work, because I was that single parent who worked 40 plus hours a week. I had to leave the home. It's hard. I had to leave her just to earn a living. And I'm trying to navigate being a special needs parent on top of that. I burned the candle at both ends. It was tough, but it was hard. I was hurt. I was devastated. I'm not devastated now, though. I love him. I think it's the best thing that happened to us.
In order to better serve special needs populations, I think a lot has to happen. There's no silver bullet. You know what I mean? There's no one way that, we can fix things so that these folks have access. So I think, there could be broader conversations around, well, how do we find funding? How do we ensure that the most vulnerable members of our society are taken care of? Maybe a moral reckoning within our own profession and also just within healthcare generally.
Choosing this career path is not an easy choice because it's fiscally very, very challenging. Working with this population requires much more time, much more expertise, yet the reimbursement is extremely low. So in a logistic manner, I think it would be helpful if the insurance companies recognize that and perhaps reimburse as appropriately. The other aspect, of course, you need the students, residents being exposed to this patient population, which is something we do. So I'm very proud of that. With UCLA School of Dentistry, the dental students also rotate into our clinic. And during that rotation, we make sure we spend ample amount of time to show them that it's okay to treat this population. And not only is it okay, but there are ways that they should all know how to manage. And again, hopefully comfortably treat them in the future.
So this is a really, great rotation that Dr. Sung's created, where we're able to sort of get these students to see what they learned in the classroom and how it's applied in the clinical setting. So they learn a lot about, patients with different medical complexities like cardiac patients, cancer patients, and then also a lot about different types of special needs patients. In the dental school, they don't really get the opportunity to treat these patients themselves. So in our clinic, they're able to, see how we treat them and what we look for and what they should look for in private practice. And something that they don't realize is how common autism actually is. 1 in 58 individuals. When they have kids, probably 2 people in their class are gonna have a child with autism, and it really is more common than they think. It's a spectrum, and each patient needs to be looked at individually. Some can be treated without sedation and might not need to come to a clinic like this, and they can be treated in the private sector. So by teaching these students, I'm trying to make them more comfortable, more confident in treating these individuals so that we can take a little bit of pressure off of clinics like ours and hospitals, and these patients can hopefully be seen in private practice where the rest of their family is seen, so that they don't have to be seen, in a special environment.
I did go to dental school here at UCLA, so it just kind of happened to be that what I was looking for in a residency program was exactly what UCLA's GPR had to offer, so I was, very happy and very content to stay put. I was very familiar with the cast of characters involved. I knew them already. They, taught some of my classes. So I was very familiar with them and what I expected from them. It's definitely a labor of love, and I see it in all of them. Clearly, if they wanted to be making the big bucks, they wouldn't be here. So yeah, that's refreshing. I mean, it's maybe a little bit more in line with what I want to do.
So I went to dental school at UCLA. Upon completion, I did my residency here, and I was fortunate enough to really enjoy it, and I like to think I excelled in it. And when a full-time position opened up a couple years later, I decided to apply for it, and I've been here ever since. So it's been since about 1992. I've been here this long for several reasons. One, the main thing is I enjoy it. I do truly enjoy doing my dentistry. I think it's something I've enjoyed throughout my career. But I also really enjoy teaching. When you reach that one student or one resident where it motivates them to push them to another level, that's extremely rewarding to me. And to hear about former residents carrying on the torch, making a difference. And the ones have gone on to different institutions and continue to teach. And then perhaps their students will continue to do what we do. So that ripple effect, yeah, that in itself is priceless, It's, I don't think I could put a price tag on that. So in essence, I actually find myself to be very lucky to get to do what I do. And there's just nothing else to it. It's good. I'm okay.